right, we'll get started. Thanks for being here. I'm looking forward to
us.
this conversation. It's one of the shows that I've been really excited about, so I appreciate both of you and your time.
Thanks for having us, Josh.
Ryan Street, who's a top-performing realtor in San Diego, but also I think more impressive than that, as impressive as your professional work in the real estate space is the service you gave to the country and to all of us. I know we're going to talk a lot about that, but I really appreciate you being here, and we've become friends over the years, and one of the things I really appreciate about you is you're a straight shooter. People know where they stand with you, but that you also give different perspectives some grace. I've been there when, given your past and your history and experience and your service to the country, and I know you're very committed to that and emotional about that, and some other people may have differing points of view, and you're very good at restraining yourself in situations where I know it's very near and dear to your heart, but you hear people out and you're very straightforward, but I appreciate that about you.
I appreciate it very much, Josh. Thank you for saying that. And yeah, you're absolutely right. It does take some restraint at times, but whether I like it or not, I'm a public figure, and restraint is not my middle name, but right. I do try to do a little better every day.
Yeah.
But no, I appreciate the sentiment, and more than happy to serve the country on behalf of any American that's here.
Yeah, right on. And Kelly Anderson, who's a clinical psychologist. I guess I should say Dr. Anderson because you earned it.
Kelly, please.
But I appreciate you being here as well. And we just met today, but I've read a number of things about you, and you certainly have a ton of experience and knowledge in this space. And we're going to talk a lot about PTSD. Yeah. And one of the things that I'm really interested to learn about is, in my little narrow view of this issue is, linked to military and combat experience. But in doing a little bit of research, I learned a ton about just how PTSD can manifest itself in people due to a ton of different experiences.
Right. Yeah.
So it's really not limited to that. And also, kind of taking a step back, the ethos of this podcast is that it started because we had someone here at Lawyers who committed suicide, and he clearly had mental health issues. So our kind of, purpose was around mental health, and it expanded from there.
Yeah.
But it once again has shined the light on the fact that there's so many issues out there, connected to mental health or experiences that, have transformed into PTSD, but nobody talks about it. Right. So in mental health in that space, it's kind of like this, when someone has cancer, everyone talks about, oh my God, how's it going? And all these things. Or if you have an injury, how's it going? But mental illness is like, shh.
Yep.
Don't say anything about it. So I'm interested to hear about specifically PTSD, but how it's linked to all these different causes and experiences.
Yeah, and definitely happy to talk about that and shed a little light on what that might look like, both with veterans and the veteran population, as well as civilians, and the various types of traumas that can kind of lead to this stuff.
Yeah. With the people that you treat or that you work with, just out of curiosity, what percentage of those people would you say? I mean, we're a military town, so I would imagine that is going to skew the national numbers, or however you want to look at that. But what percentage of the people that you work with are veterans?
For probably with the practice as a whole, between myself and my other clinicians, I would say it's 50 to 55%.
Okay.
Yeah, so it's high. And a piece of that too is that I'm VA trained, and so I'm trained in a lot of the trauma-focused treatments myself, as well as my counterparts. But yeah, we have a huge prevalence of both active duty and veteran individuals here, and their family members who go through a lot of this stuff and face a lot of trauma themselves. So it's pretty high, and I think that that's probably representative kind of across most of the county, I would say.
Right.
Yeah.
What is that when you talked about the VA training, or, talk a little bit more about that?
Yeah. So through even starting back in grad school and then internship and postdoc, I worked in VAs across the country, actually. So working with primarily veterans, sometimes families, but a huge percentage of people who are coming back from OEF, OIF conflicts. You can talk more about that later on, as you kind of mentioned, who, yes, oftentimes are looking at PTSDs as well as TBI, traumatic brain injury, lots of different things that are going on, reintegration, that kind of stuff. So I was trained really with working with veterans and have some specialty in trauma-focused treatments specifically. So I'm certified in a couple of treatments to kind of help people move through that. And then these treatments are also used with civilian populations. So you can use them whether they were combat trauma, military sexual trauma, or I got in an accident while I was active duty, but it had nothing to do with my service. So there's lots of way that trauma can show up. And then these treatments are really designed to help people kind of process that and get through. And we don't have as many suicides as we see, which are connected with trauma or trauma-related disorders. Yeah.
Yeah, I think it's huge that you've built up that experience or knowledge base with veterans and been able to experience it in different locations, but different patients and things like that. Because one of the things that I've always wondered is if you don't have that experience or knowledge, or you haven't actually been in combat, or you don't, it'd be tough to relate. Yeah. So, because we had a show that we did on transitioning from active duty into civilian life. From the military, and I think that was one of the things that was a struggle for a lot of people that were transitioning, was that, the programs that were being provided either by the military or the government or whatever it was weren't necessarily being run by people who had kind of walked in the shoes all the time. And so for a lot of veterans, it was like, well, you don't really know. You haven't walked a mile in my shoes, so to say. So I think it's huge that you have that experience. And of course, you didn't have it from the jump, but now that you've built it up over time, it gives you that credibility. To work with these guys.
I think a different perspective. While I would never ever say I could fully understand what it would be like to go through anything like combat or any other trauma that I haven't, a car accident, things like that. Certainly having worked with a number of people who have, I think it's a very different perspective than when I was fresh and new and hadn't heard my first combat-related story, didn't understand any of the acronyms, for example, that kind of stuff. So it does help, and I think it can help to build that credibility. And I think one of the things that's really interesting, and I'm interested to hear your perspective as someone who served, is just reminding my clients, whether they're a veteran or not. I might not know what you went through. I just have the knowledge of how to best treat that, and you have the knowledge of what you've gone through, and we put that together to kind of make the best steps we can forward. And it tends to work better than it doesn't most of the time. But it's a tough diagnosis. PTSD itself, or working with people who've been through trauma, takes a lot of strength as a client to kind of approach that and want to deal with it. So it's effective treatment when you're able to do it, but hard work for everyone, I think.
Yeah, I would think so.
Yeah.
What about you, Ryan? Why don't you tell a little bit for the people that are listening or watching about your own experience and kind of transitioning through and dealing with some of the issues that have prolonged with you? I mean, you've been extremely successful about navigating through that, and so I think your experience would set in with a lot of people, and I think it'd be very valuable for them to know and understand.
Josh, I'm not sure I would categorize my transition as highly successful. I would categorize it as I'm very good at hiding certain things. And I would, going back to your statement about transitioning out of the military, I would say it's closer to 100% of veterans that struggle with the transition from the military back into civilian life. And I think it's a kind of a sliding scale. It varies somewhat based on how long their service was, if it was a single term or if it was a full career or anywhere in between. From my experience, the hardest part of the transition was going from having such a dynamic schedule, and we have dynamic schedules in real estate. That's the reality of things if you're selling 30, 40 homes a year plus. But it's not quite as time, what's the right word? The time constraints between meetings are all, you're boom, boom, you're always got somewhere to be, and then all of a sudden that stops in a day. And I think it's a combination of not knowing what to do with yourself because you're so conditioned in being busy all the time, and then also couple that with maybe the visceral or the ego portion of being needed somewhere or contributing to something greater than yourself. And that was a slogan that was used all the time. You're participating in something greater than yourself. And at the time, it doesn't really register. It doesn't resonate with, at least it didn't with me. I was just doing my job. But once it goes away, it's very real. And it's kind of a downer, you know, and I think that contributes to difficulty in transition. You know, I struggled with that for probably 3 years.
Yeah.
Just, you know, busy, I'm fine. If I'm running high, I'm fine. If I'm not, things start to creep in. Memories, you know, hypervigilance is something I deal with all the time. I can't sit in a restaurant, or I avoid crowds at all. At any possibility, I will. When my family wants to go to the fair or Legoland or Disney, I'm in my own personal hell for 4, 6, 7 hours, whatever it is.
Is that like because you know you can't survey it and you don't know who to trust?
It's
like
exhausting because you're constantly, and it's involuntary. You're at least for me, and it's subsided some, I'd say, in the last 2 years, because it's exhausting. You're constantly searching for the threat, whether there is one or not, right? You know, who can handle themselves, who can't, what are the weapons of opportunity, should X, Y, or Z go down, how is this scenario going to play out? And your mind is constantly going, you cannot turn it off. Right? And entree the substance abuse piece that goes with it, that's the only way that I have found where, you know, not that I abuse substances, but that's to slow down the thoughts, the mind racing, because it's going all the time. I tell folks privately that, you know, I metaphorically I consider my brain as a wood chipper, right? Metaphorically, if I don't feed it something to think about, it's going to cavitate, right? And nothing good is going to happen,
right?
If I'm not constantly thinking of something. Could be a defense mechanism. I don't know. It's just what I do. You know, my experience in the military, I was in the air wing, specifically, Hueys and Cobras with the Marine Corps. I was in Afghanistan first, right after September 11th, with Operation Anaconda, Task Force 58, whatever you want to call it. You know, and we had some experiences there. Obviously, I can't pinpoint where and exactly when. I think it's a culmination of experiences. But my first perceived combat experience was, I think it was December 7th, 2001. We were being probed by the Taliban, and we were, you know, mortars were going, right? We were shooting mortars a lot, you know, flares were going up. We were inside of a compound, but I do recall, you know, we had been there for a week or 10 days, not knowing what's going to happen. The not knowing is difficult. Eventually, you just kind of let go, because if it's your time, it's your time, because it's debilitating to constantly think about what if, and you just kind of let go.
Right.
But that night specifically, I remember, you know, the gunnery sergeant that was in charge of us, Gunnery Sergeant Rooks, you know, he had us go what's called Condition 1 on our weapons, which is locked, loaded, ready to fire, like you're ready to go. And I remember right after that, just hearing 200 or 300 Marines. There were Navy SEALs out there. There were Australian SAS. All of those chambers, lock and load, was almost like a symphony, right? Things started going into slow motion. I could see much better than I could previously. I couldn't hear anything. Nothing. I couldn't hear anything. It was the strangest sensation. I couldn't feel anything with my hands, but I knew I could function in whatever capacity I would need to as things unfolded. Fortunately, that evening, they never got through. They were just seeing where we were at, kind of thing. But that was rugged. Yeah. That was. I'll never forget that.
Right.
You know.
Thank you for sharing that, first of all, because I mean, like I've said before, I mean, I'm so grateful for your service, but like just even being willing to kind of go back in time and go through that for us is amazing. So I appreciate that. It's interesting that, you know, because again, in my narrow view, like I would think, like PTSD, like you'd have to be a part of like something, like something far more, like, I don't know, like poignant or traumatic or, oh, hey, someone got shot or this blew up or something like that. But just that, well, I guess stress is in the acronym PTSD, right? Like that situation, if you do it day in and day out, or the not knowing or whatever, that is the culmination of that stress. Can that create it, or is it always like a poignant moment?
Yeah, both. Right. So some people are able to say, this is the exact moment that I know this all started, right? After this day, everything changed for me. And then in situations like you were in, where it's this day in, day out, right? It's that chronic stress. Am I dying today? Am I living today? What's going to happen? And that in and of itself is traumatic to think about. I'm hearing mortar fire, and is that headed in my direction? Is this it, right? So you can imagine how that starts to culminate in the sense of lack of safety anywhere, which shows up at Legoland and surveying a threat, because you've had to be on this high alert for weeks, months, years, in some cases, depending on the length of deployment. And it starts to culminate, and you can't disentangle which moment it started with. And then, of course, in other situations, there's something incredibly specific that people can pinpoint.
Like car accidents,
yeah.
Things like
yeah,
that.
exactly. An assault, something like that.
Right.
Yeah, so it varies a bit based on who you are and what you've been through. But yeah, it is, stress is in the name for a reason.
It makes sense, like just that like preparation or perception of danger, right, would be enough. Because if you think about it, like I can only imagine, like if my wife was home alone and she heard someone wrestling in the kitchen or something, and knew I wasn't home, but then came down and there was nothing, that she would probably be unable to sleep for days on end, thinking like, was someone in my house, right? When nothing really happened. Something happened, but it wasn't, you know what I mean? So it makes sense.
Yeah.
It's interesting to me that you said everything numbed out, and because I've, in researching this and just, watching some stuff and reading some stuff, a number of people say that, the term kind of adrenaline junkie or
definitely
whatever,
an adrenaline dump.
Like it just, it's a negative experience, but like you get those feelings in your body that are like you're almost unable to control the chemical reactions within yourself that are happening, but you're so well trained, and it's so muscle memory, and it's like you've done it 1,000 times practicing and whatever you do, that like you said, it's like like the symphony, and everyone's like ready to roll. And even though you can't feel it, your sensations are almost out of control. Like you knew the whole time you were absolutely in control of like what you would have had to have done if you had to.
Right.
That's intense.
Yeah, it is.
And I think that contributes, that the adrenaline dump when you are in a combat situation, or whether it's when we first started coming back, not so much early 2001, because we were there, that was the kickoff of everything. And then I think 10 months later, after we got back, we were in Iraq. And then, and that was a very large presence, scattered throughout Kuwait and whatnot. But the rotation, 7 months there, 7 months off, 7 months there, some guys and gals did 7 or 8 deployments in 10 years. And once you have, and it doesn't have to be that long a service, but I think with the high risk behavior that a lot of service members came back, specifically motorcycles, guys and gals were coming home and killing themselves on motorcycles because they hit that new red line in country, in combat, right? They hit that adrenaline thing, and like anything in life, once you have a new peak, you're going to try to get there again. And everything you did in the past to get there isn't going to get you there anymore.
Right.
That makes sense. It's almost like an addiction.
And if you're unable to find that new peak, then
people start
alcohol,
doing
drugs,
skydiving,
right? Like base
motorcycles,
jumping,
all that stuff, right?
Yep.
And that's rarely ends well.
Yeah.
Right.
And I think that chasing the adrenaline also really helps. Kind of the core piece when we're thinking about this from a clinical perspective is to undermine avoidance. That's what PTSD is, avoiding the trauma, thinking about, feeling about it. And adrenaline feels a lot better than fear. Adrenaline feels a lot better than nothing at all on those days that you can't feel anything, because if you have to feel the good stuff, you have to feel the bad stuff, and it's a lot more fun to jump from a plane, and you've already faced death once, so right? And so that can feel really good, or sort of a sense of relief, along with the drugs and alcohol. It can either numb things out or make you feel better, which when you're dealing with something like chronic PTSD, every day you're dealing with this. Every day you kind of mention, my transition didn't go well, I just hit it really well. And this is how a lot of people with PTSD would describe their day in and day out. You don't know what's going on inside, but every day you wake up exhausted because you've already dealt with this the day before and the day before that. So yeah, it's that new red line, and you're chasing that sort of dragon, so to speak, right? And then it's also this avoidance of anything that might feel bad, because it's just so exhausting.
Yeah. So when you're diagnosing people, so PTSD, are there physical, chemical, physiological things that you can measure, whether it's like cortisol release or whatever, those types of things where you can say, oh wow, these are certain symptoms that you would see from other than someone coming in and saying, hey, wow, you mentioned car accident, hey, I was in a head-on collision and whatever, and saw all this and felt all that, and you're like, wow, this is maybe this because it's a traumatic event. But how do you diagnose someone outside of the obvious?
Yeah, well, so to answer your first question, there are physiological markers and even neurological markers of PTSD. I can share this much about that because it's outside my scope.
Sure.
But you can look at someone's brain prior to trauma and post-trauma, and neurologists can see differences in parts of brain structures that are overactive or underactive, structures that have shrunk, and then you can take measures of things like cortisol, things like that. That's not what I do. And so I do go to the more kind of, there are 3 areas that we look in and sort of assess, and we can do that through interviews or through measures. We can do formal neuropsych testing, diagnostic testing, where you look at areas such as behavior, so behavioral avoidance, cognitive avoidance, and then physiological kind of reactivity. You mentioned visceral at one point, and that's kind of what I'm talking about there. So cognitive avoidance would be not thinking about what was going on. What's an example that you might use to not think about any of the
what would I think about?
To distract yourself. Yeah.
Money.
Okay, great. Makes you successful. Kind of right. So instead of thinking about,
I would have guessed.
Yeah.
Like just business, money.
Yeah.
Try to find something positive, and that was what I kind of went towards.
Yeah. So anytime a thought comes up about the conflicts or what I faced or transitioning, I'll just think about money, business, how I can move forward. And then there's kind of behavioral avoidance. So anything that, and I didn't hear, you actually said that you did a lot of charity work on Pendleton, things like that, but a lot of the veterans I work with, and even sometimes active duty, won't go on a base. You won't find them on base ever. If they see someone in uniform, they walk away because that's just hard to kind of, it brings back all the memories of serving. Certain smells or sounds can bring that all back. So I won't go to this area that might have these sounds that sound like rounds or whatever the case may be. So that would be behavioral. And then the physical reactions which show up, which can be anything from heart racing, hyperventilation, feeling dizzy, lightheaded, to a full-on panic attack, if you're kind of faced with any thoughts, memories, or anything that sort of reminds you of whatever the trauma was. And so people will work really hard to avoid anything that makes them re-experience that stuff. And then there are things like nightmares, flashbacks, things like that that we'd assess too. Yeah.
Wow, intense.
It's a lot.
Yeah, I heard a story about when a guy saw the movie Saving Private Ryan, that he had to step out of the theater because he smelled like the diesel fuel or something like that. Gosh, it's amazing how the mind works.
Yeah. You
know what I mean?
Yeah.
It's intense. So what are some of the, like, let's say someone's listening, watching this podcast, and they're like, wow, maybe I'm afraid to say something, maybe I haven't found the right person I'm connected to that I can open up to. What would be kind of your advice, and I'll open this up to both of you, but what would be your advice for if someone was out there, and whether it's a veteran or someone who suffered from rape or intense car accident or any kind of experience like that, where they may be thinking, God, what's wrong with me? And maybe as they listen to this, go, maybe PTSD might be it. What would be your advice?
Yeah. So, and I mentioned this a little bit earlier, it's really tough to want to face all this stuff because the whole way you get through PTSD, or the way that most people feel like they get through it, is this avoidance. But if someone felt ready to kind of work on this, things were coming to a critical point in their life where it was just affecting what they were doing on a day-to-day basis, I would say start with the internet. It's a good thing we have that, right? And just sort of look around you. Are there psychologists, psychiatrists, counselors of any sort around you that you feel like you might be a good fit with, right? So do they have training in this? If you're a veteran and you want to look through the VA, there's certainly lots of programs there. Some people have a preference for that, some people don't. If you're a civilian, you can go through your insurance, you can Google Psychology Today and start looking for someone that you might want to even just have a consultation with. Is this what I think it is? Is this PTSD? And if so, what would be the next steps? Do I feel ready to kind of work on this? Medication can help, and so psychiatry is there for that. And oftentimes there are people who have their values where they feel like medication is awesome. Other people are not keen on medication or haven't had a good experience, but there's that option as well. But I always say there's nothing that can be too terribly harmful about setting up a consultation with someone and just sort of talking about what would I do, what would this look like, and then you're a little bit more informed on if you're willing to take that next step. Because it's tough, and most of the treatments take several months where you're talking about this stuff over and over again. It can be really tough for people. And it's really successful. Most people, I can't remember the percentages, but for the therapies that I'm trained in for trauma-focused treatment, there's like a 85% sort of reduction down to baseline with these symptoms that we're talking about. So if people are able to get in there and get treatment, they tend to find that it's pretty helpful for them. PTSD doesn't just go away. There's not like a cure for it. You don't get done and get like a little check on your chart saying no more PTSD, but you might be able to live a life that's a little bit more like what you imagined, where you don't have to avoid the day-to-day stuff. You don't have to avoid people, places, or things that remind you of trauma. You might still have panic attacks, but maybe they're not happening daily or multiple times a day. So it can be really effective. But I think that the first thing I always let people know is do some research. Look at, if you go to a therapist directory, there are pictures, there are profiles, there are training and background. There are lots of therapists who are veterans themselves. Maybe that makes someone feel more comfortable if you're a veteran looking for treatment. So you can kind of look and find someone that you feel like you might connect with and then take that first step.
Yeah.
And see how things go.
I like how you started the whole thing with, if you're ready.
Yeah.
Right? To me, if I'm going through something, like, it raises a red flag if someone's like, go here, go do that, pay this money and see this person and do like the one size fits all right now.
Yep.
So I think there's a lot of wisdom in that of going online and just seeing like, hey, what are the options out there? See what this process is like and get yourself prepared for whether you want to, seek help or talk about it or get there. So I think that's I think that's wise advice.
Yeah. Yeah.
How about you, Ryan? What would be your advice, and maybe specifically for veterans coming back? And
how much time do we have? I think my perspective is I've been through it all, right? My diagnosis came, whether I liked it or not, in 2008 when it was still significantly stigmatized. I was still on active duty. I had gone through just about everything there is, right? I was in therapy for 10 years, on and off, to include, talk therapy. I found hypnotherapy to be incredibly effective.
Wow.
But going back to like what you said, you have to be ready, because I wasn't, right? I went at the behest of a loved one that was more or less forcing me to go. We're no longer in a relationship, but I didn't let it all out, right? Initially, I still had the ego. I still had the, this is not me. This is not, I'm stronger than this. This is a weakness. This is not me. So my recovery, or recovery is not the right term, but what I found to work was, because you do deal with it on and off all the time. I'd gone all the way through just about every one of the medications. Nothing worked for me. I did not like the side effects at all. I did I was seeing a therapist, I think, twice a week at the most frequent, and then it was down to biweekly. And I found that gardening helped me immensely. I had this stupid little salsa garden at my house in North Escondido, and
That's cool.
It was something I grew up in. I'm from Minnesota originally. We always had a garden, and it was just kind of, I tripped over it, right, as an idea, and I learned from that veterans, guys, gals that have done something so selfless for so long have to have something to take care of other than themselves, because
Wow.
we won't take care of ourselves first. It's almost impossible to convince one of us to put ourselves first. It's always something else, the greater good, right? So those plants were what I was taking care of because they were incapable of taking care of themselves. I've since transitioned to birds. I've got a place in Hidden Meadows, and there's a lot of doves and a lot of quail and songbirds, and I feed them. I go through like 300 pounds of bird seed a month.
Wow.
And that's my thing. When things are escalating for me, I'll just walk out in the backyard, cup of coffee, and just watch these stupid birds do whatever it is they're going to do.
Right.
That was my thing, or is my thing now. What else would I do?
That's super interesting.
Yeah, it's and I would even spin that into, you've got these guys that and gals that, maybe their skill set isn't quite as transferable into the civilian world, specifically infantry, whatever other military occupational specialties isn't something you're going to find, a lot of opportunity in. Protecting schools, you find a service member that's out and struggling, and you offer them a position as an armed guard at a school with a livable wage, you will not find anybody better. That service member will die for those kids.
Right.
I mean, without even thinking about it. Should there be an active shooter situation or something like that. So
Right.
It's about finding something to take care of that is not you.
Right. How interesting, and it's something that in the other shows we've done with military, the feeling that, you mentioned your ego and kind of the tough guy thing, right? But it's like you're trained to be that way. You're trained to be a beast, right? Like you're trained to be under the most critical situations, able to take someone's life if need be for the mission. Right, and I mean that's about as intense as it gets, and then it's a complete U-turn to turn around and say, "Hey, I need to talk to someone about these things I'm struggling with, and issues I'm having," because especially as men too, just stereotypically, right? Especially when you're still active duty, you know what I mean. There's that feeling of maybe somebody being like, "Hey, suck it up."
Well, that career retention, guys are 10, 12, 13 years in or less, and their intent is to retire with, the pension and the benefits that go with that, and there's disqualifiers in there, There's things, I guarantee you, 85%, maybe less, of service members that have combat experiences hide symptoms, hide things, hide behavior, in order to stay in.
Right.
Because if you go see the psychiatrist in the military, the Navy or the Air Force, the Army or the Marine Corps, we call it going to see the wizard. And it's not frowned upon really anymore. It's not even really stigmatized much anymore. But there are, I talk to a lot of my friends that are still active. They're starting to retire. They started to retire about last year.
Right.
And they're since getting out, and there's injuries, physical injuries they'll hide. It's all about getting to the end. And when it comes, the toll that takes in and of itself prior to the transition, and then, folks that need, like you said, you got to be ready. You got to for the treatment to be effective, whatever it is, right? You have to be at a position of where, and at least for me, it was, I can't do this anymore. I refuse to live like this. I don't think I was ever suicidal. I don't ever recall having those feelings. But the debilitating exhaustion, there's got to be a better way. So my path was I reached out to Military One Source, which I'm not sure is still a thing.
Mm-hmm.
It is?
Yes.
Okay. And that's a way not to necessarily circumvent, naval medicine, because that was I was a Marine. But you go outside of the purview of the scrutiny that may end your career prematurely, right?
Got it.
Because not a lot of, coming up
Yes.
the Iraq and Afghan, enduring freedom, Iraqi freedom, whatever we're calling it, this is new, right? We're really, we've spent the last 10, 12 years really digging into this with an open mind, and Dr. Anderson can probably speak to that better than I can. But what I can say is, the guys and gals that are still active or have retired recently, I'd say almost all of them are hiding something in order to stick around. And then, but like I said, you hit that bottom. And I called Military One Source. I found a counselor in Valley Center. She was great.
So is Military One Source,
Mm-hmm.
it sounds like it's something outside of the actual military branch, where if you went to ask someone for help or something within, that maybe gets reflected on your record, or everyone knows about it, where maybe there's some outside sources you can go
It's
to.
still connected to the DoD. That's who funds it, right? And it is limited. I think at the time I was getting 12 sessions every quarter, or maybe semi-annually, or annual or something. And then it was out of pocket after that.
Right.
But it
a little
didn't
more
really
confidential
matter.
though.
Yeah, you're going to get a civilian provider, somebody who most likely does not or has not worked in healthcare for the Department of Defense or the military or whatnot. And I withheld things until I was comfortable with her, and my treatment, whatever you want to call it, took longer than it needed to, because I hadn't quite hit that position of I can't do this anymore. I'm not sleeping. I'm thinking about consuming alcohol all the time, if not doing it.
Right.
And we know right from wrong. I would take it even a step further, and we might go down a rabbit hole. So go ahead and stop me if we need to. That breeds guilt, because you're doing something that you shouldn't. It's a temporary fix, and you're just kicking the can down the road.
So you're feeling even worse about
so
yourself.
You wake up, right? You're hungover, or you're cloudy, and now you're thinking about your conduct, and your self scrutiny is far more powerful than anybody else's, and it's an endless cycle, right? And until you kind of slap the table and say, no mas, I'm done. I quit drinking for a year, did the gardening thing. Exercise helps immensely, which is something I don't necessarily do as much as I should these days. But there's things to obviously out there maintain it. CBD has been effective for me. I know the medical marijuana option is out there as well. The VA does somewhat embrace that.
I was after my time there.
Okay. My experience with the VA in San Diego has been nothing short of impressive. I know in other regions in the country it's not as good. But they have satellite offices even in Escondido. You don't have to come down to La Jolla. There's Oceanside. I would imagine there's something in Scripps. It is out of my purview. But it comes down to the individual being ready and willing to, one of the hardest things I did was submit to the hypnotherapy, which, the provider indicated, or showed me statistics that, for talk therapy, you're on 100 appointments, you're going to be this successful. You're going to have this kind of experience. You could get the same experience or the same level of relief from 5 or 6 hypnotherapy treatments. And so I had to kind of warm up to that idea. I've only done it twice, but the relief from that, in contrast to talk therapy, was almost impossible to measure from my perspective.
Yeah.
That's an awesome story that you just shared, because knowing you how I know you, you're such a straight shooter and such like a man's man, like that for you to give that type of testimonial to the services that are out there and the process and opening up and saying, hey, look, I'm whatever, sick and tired of being sick and tired kind of a thing. And so I'm willing to do all these things and step outside my comfort zone. And then to say, hey, the VA's been great. Like, the results were there. Like, I know you don't pull punches, right? Like, if you would have had the opposite experience, you would share it very
I would.
clearly.
Yeah, I like you said, Josh, I am a straight I don't know how to lie. I don't have a filter. I don't sugarcoat anything. But yeah, that was, I had submitted my VA claim the day after I retired. I had my response like 7 weeks later, where I heard of other guys and gals, waiting like a year or blah, 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 or whatever. I mean, it was like this. And when I had my appointments, for that claim, I did have to travel some because, we're inundated with guys and gals getting out. There's only so many doctors that do so many specialties, etc. But I have nothing to complain about, and if I did, nobody would listen. So
ingenious too, the way they position the hypnotherapy to you, knowing how you think and how most military people think, and saying these 3 to 6 might be worth 100. So if you were opposed to it in the beginning, thinking, I don't know about this foo-foo stuff, and then you said, wait a minute, you're going to save me 10 months of time?
Right.
I'm in.
Yeah.
Right.
No, I think the thing that held me back from it was ignorance. I didn't know what it was going to be like. I've been, everybody graduates from high school. You got the hypnotist that comes over it, and you got your overnight party or whatever it is you do, right? And you see these people acting like,
chickens and
circus apes, right? Doing whatever the hypnotist told them to. They obviously, from my perspective, and they look like they are completely out of control. They are not making decisions or they're responding to somebody else's influence, right? I'm like, is that what I'm going to be exposed to? It was anything but that. I was aware of what was happening around me. I'm sure there's varying levels of hypnosis. I didn't go. She didn't take me that deep. And I was really impressed with how it went, so I did it one more time, and then kind of moved on to other things. But unfortunately, she has since moved to Arizona. She had an accident on her horse, and could no longer treat anybody. But
great that she was there for you, though.
Yeah, bro, it was. And I probably referred her, I don't know, 20 friends. And family members of friends and that. So, and never received any negative feedback. So, what's out there and is available is helpful. There was one other thing I wanted to cover quickly. I mentioned I quit drinking for a year. I actually went to AA and did that whole deal, like let go. I'm gonna find out if I'm an alcoholic. And what I learned was, I'm not. I am capable of being a binge drinker. I don't think anybody who's not in real estate can't understand that. But I saw real, and I think what may hold some guys back is, or gals too, is the alcohol's their only tool currently, right? And they may not want to give that up because that's kind of working for them for now. And I would encourage anybody that is considering or is nearing that point of I can't do this anymore. Don't think that you absolutely have to stop drinking. Maybe take a break, go to some meetings, observe the people that are in those meetings, absolutely struggling to get through minute by minute by minute to not consume. Right? I mean, I saw it.
Right.
I probably went to, I don't know, I was doing 3 meetings a week for a while, and then I dropped down to 2. Varying locations. Some of them were not just AA, they were NA as well. And that's a whole different animal.
Yeah.
Well, it probably goes towards anything, right? Like, for you to say some people become obsessive about a lot of different things, but if they just go, well, I'm going to give up this, I'm going to give up that. But if they're really not willing to go where you went, which was, what's at the root of all this? What's the experience that I need to kind of face, deal with, right? That I'm trying to medicate or whatever it is that, you know what I mean? And so if you're not willing to get there, then you're really just kind of dealing with the easier problem, even though that may not be an easy problem to deal with. But I'll deal with this now. It's like, yeah, but at some point you got to get down to the core of this thing and figure it out.
For sure.
Yeah. So I love the part about the garden and the birds.
Yeah.
Yeah.
Thing like that. That's like very interesting to me because I would think that's kind of you could put a lot of the veterans in that bucket of selfless, heart of service, that value of helping something that really can't really give you a whole lot back, but you just have that heart of service. So are there any other things like that? Is that something that goes across all the different people that have PTSD?
Yeah.
Whether it's, veterans or not, where if they find some kind of healthy outlet or something they can invest themselves into?
Yes, right. Finding purpose, and that's true for people who've served and people who haven't. And what I think I might have heard, Ryan, too, is that when you're out there and you said you have, your cup of coffee and you're just sort of watching what the stupid birds are doing, there's a little bit of mindfulness that's going on there, too, where you're just in that moment sort of watching what's going on. Maybe that's happening when you're gardening or when you were gardening. And that's a huge component with trauma-focused treatment as well, is one way to really adaptively and really healthfully get away from all of those thoughts and memories and images that pop up are to find things to focus on that are really good for you. And it might be feeding the birds, it might be gardening, it might be sewing or adult coloring books. You could pick whatever you want, right? It's going to be a little bit different for each person. And what you start to do is you start to train your mind to focus on just this one thing. And some of those trauma thoughts will sort of trickle in a little bit. They'll kind of distract you. And then you say, no, I'm listening to the birds right now, or I'm having that sip of coffee, or I'm coloring this swear word coloring book, right? And so it teaches you to start focusing on what you want to focus on versus letting your mind just kind of over and over again have these intrusive thoughts, which starts to take effect in other parts of your life. So for you, it started with business and growing what you've done with your business, which probably, from my very limited understanding of real estate, is very intense. It's things move fast, right? So it keeps your mind kind of occupied. But in those slower moments, we need things too. So you'll see a lot of people with trauma finding these very fast-paced, high-intensity jobs or outlets. But we can't run at 100% 24 hours a day. And your mind knows that. Our minds know that. And so the moments before bed or when we're first waking up, these creep in. And so learning how to really practice this mindfulness and being present is a training tool. And we actually, not myself, but people out there who do brain scans can see that, again, you're going to change the way that your neurons talk to one another. The different brain cells kind of communicate as you practice mindfulness. And people tend to find that what used to be 5 minutes of feeding the birds before I couldn't do it anymore is now an hour after day-to-day practice. So yeah, finding whatever it is that might be interesting for you or works for you in terms of what you want to focus on, those are really, really helpful. And much like what you're saying, Ryan, in terms of finding something else to kind of care for, again, I would see that across, civilian and veteran populations. And then I really push for people to engage in the self-care as well, whether they like it or not. Because we do have a tendency to kind of help other people around us, and that feels really good. But you might let yourself kind of deteriorate. And so maybe the birds are helping them, but it's a moment for you too. Or, I might really tend to these plants, but I'm going to find something that really recharges me too. So kind of finding a balance there, I think, can be helpful. And for most of the therapies that are out there, you're going to see this component woven into that treatment in some way or another. But if, people are listening now and they're not quite ready for treatment and they're thinking, what could I do? Find something that you really enjoy, that feels helpful, that feels good as you're doing it, and see if you can spend 5 minutes a day focused on that. And after a few weeks, you might try 10 minutes a day until you get to a place where you have a little bit of peace while you're doing whatever it is that you've chosen per day. And that might just be kind of your safe spot and your kind of zone to go to get a little relief from what's going on.
Right.
Yeah.
No, that makes a lot of sense. For all the people that you treat, do the majority of them go through you said there's no finish line, right? There's no like, okay, cool, you're cured.
Yeah.
Right? It's something that's more, how do I effectively and healthily get through this and find ways to cope and become the best me I can be.
Yep.
How many people go through the whole process with you? How many people do you see once and it's just too much for them and they're out? Like, is there a big kind of fallout?
And I think part of this is, I've been doing it for almost 12 years now. So if you'd asked me that 12 years ago, I would say, oh, it's like 50-50.
Right.
But I've learned. And I think one of the pieces that is really important is starting with, are you ready? So if someone comes to me and they're like, my wife is making me do this. She said it's divorce or this. Okay, well, we can try, right? But it doesn't feel like this is going to be successful versus the person who's kind of ready to work, right? And if someone's not quite ready, we can use strategies and coping skills to kind of get them to that place, to move them in that direction, to start feeling ready. And I think that's an important piece too. And I'm pretty, as far as therapists go, I'm also pretty straightforward. I'm not the therapist who might be hugging you after every session, that sort of thing. And so when people come in, I let them know, like, this is hard work. This is going to be one of the hardest things that you've done. Sometimes people tell me this is harder than the trauma itself. So if you're not ready for that and ready for it to potentially even get worse before it gets better, let's work on some coping skills. Let's find you some AA or NA meetings to kind of get you through this and then come back to me when you're ready. So I think now, if people are ready and we kind of build that relationship and we kind of assess that readiness, I can get people through to the end, right? And it's not just me. I'm not doing something special. This is for any therapist who's worked extensively with patients with trauma. If they're not ready, you can tell that pretty quickly. And if they can't get ready, there's no point in trying, because then what happens is they get halfway through, they say, this is awful. Kelly's a quack. Therapy doesn't work. And then they never want to come back versus, saying, it doesn't seem like you're ready. Let's try to get you there. Or if you're not quite ready, come back when you are, so that you're not left with this bad taste in your mouth of really bad therapy that you then generalize to everyone else.
Yeah.
So if people can stick through it and they have a good relationship with their therapist, most of my clients will get through that. I have a lot of colleagues who do the same work and they'll say the same thing. But I do think that fit is crucial. And so going back to people who are looking for that first step, that's why I say start at the internet, do some light, stalking of various therapists, do a consultation call or video chat if they offer one, if you can't get yourself into the office. And if you feel like, okay, I can talk to this person, then you're ready for that next step to see if you can even go through it, because it's tough. It's really tough stuff.
Yeah. I think especially for, I know I consider myself a pretty driven person.
Mm-hmm.
I know him personally, and he's very driven.
Yep.
And we just got to know each other. But like in the fact that it almost gave me anxiety when you said, try 5 minutes this week and then 10 minutes 2 weeks from now, because I'm just that guy that's like, no, I want it now.
Mm-hmm.
Like, so I'll do 50 minutes today.
Yep.
And you know what I mean? But
set yourself up for failure.
I'm also the guy that goes to like the fitness place and I'm like, look, man, I want you to push me. I don't care if I'm throwing up, and then I'm not going back. I don't go back.
Mm-hmm.
Yes.
3 days later when I can barely sit down because my legs hurt so bad.
Right.
Exactly.
So there's I think your approach is, you've learned it over time.
Yep, 100%.
But it's I can see that being much more effective.
Yeah.
Like, are you doing this for you? Are you ready to be vulnerable?
Exactly.
Are you ready to be honest?
Mm-hmm.
Right? Are you ready to like kind of check yourself at the door and let me help you get through this?
Exactly.
You know what I mean? If you want to eat the whole elephant today, but we're going to eat it one bite at a time. Type
Right.
thing.
Let me ask you this, Dr. Anderson. So my experience was I got drugged kicking and screaming to therapy the first time. And initially it was with my ex-wife, her idea.
Yeah.
And I didn't want to go, but I went.
Yep.
By the third session, she had quit, and I kept going because, I think my hesitation was tied to ego, not wanting to admit, waste of time. This isn't going to work. This is, witch doctoring.
Yep.
But I think, do you notice, or it may not even be a metric that you track, but similar outcomes where somebody comes at the behest or force of somebody else and they're standoffish or they don't want to participate initially, but by the third or fourth session there's commitment and improvement? Yeah,
and I think that's, it's not something that I track per se, but just sort of pulling up thoughts around that. I think it's really individualized.
Okay.
So, usually by the third session, if they're still kicking and screaming, I put them on therapy vacation.
Right.
You're not here, you're not taking much from this, right? But I think oftentimes, and if you're working with someone that you're comfortable with, there might be just a little bit, right? So, okay, you're not ready to work on your trauma, but we have 10 other things that we can kind of start working on. Maybe it's communication with your partner, right? So let's work on that. Maybe that's easier. Get the old wife off your back, right? Or maybe it's, you're not sleeping well. Okay, let's focus on that. Get you some sleep hygiene skills. And then maybe once a client starts trusting in that there are other things that we can focus on and that these things help. It's not all witch doctoring.
Right.
I'm not going to shove pills down your throat. I don't even do that, so go somewhere else for that, right? Then there's a little bit of trust, right? Which in order to become vulnerable enough to do work for trauma, but really any sort of therapy work, you have to be willing to be vulnerable. And it's not, people come into my office the first time that they meet them and I ask them to tell me the hardest things they've ever experienced. It's really, really hard to do. And not everyone can do that in the first session or the third. But if you're willing to kind of work through it, then yeah, it's just that willingness to open up and make yourself vulnerable and feel like you're in a safe enough spot to do that. So yeah, it can, if people can get to that spot and sort of recognize, I trust this person. I think they have the credentials and the personality to kind of fit what I need. So I'm willing to let that wall down just a bit. But there are people who are there in session 10 where we're both banging our head against the wall because they're just not ready. I think it's, I view it as my duty to kind of say, you're not ready. This is not helpful for anyone. So let's come back at another point, and I'm here. Yeah.
What, are there if you had to give a top 3 to 5 different symptoms that you see in someone that's suffering from PTSD? Is that a fair question? I know each individual is different, but maybe a group of ones of different symptoms that.
Yep. Yeah. So I would say, really, I mean, it comes down to avoidance. It's just what that looks like in someone's life. So usually if I'm working with someone and I use that word avoidance, so you've just been doing this to avoid, they're like, oh, okay, yeah, that's right. And it can look like a lot of different things. It can be the person who doesn't stop working ever. They're always at the office. They can't settle down. Sleep is almost always a piece of this, whether that's because the anxiety leading up to trying to come down and slow down, or the nightmares that can be kind of happening, but really poor sleep. And then I would say substance abuse is pretty high up in there. I would say that that's kind of coming up there. And I'm going to step back a bit and say not just substance abuse, but maybe any sort of addiction. So certainly the substances, right? But then food, promiscuity, phone. I can never be without my phone because it's such a 24-hour feed of distraction, right? So it's, that's a big piece as well. But so any sort of addiction kind of or addictive like behavior, I would say, is kind of a clue that you're avoiding something.
Right.
Yeah.
Very interesting. And I know you were like, yep. Sleep, it was
there's a lot of it.
Yeah.
Yeah, it's sleep, I think, is probably the most important because it's the vicious cycle, right? If you're abusing anything, probably not food. I mean, you can probably sleep okay if you're pounding 10,000 calories a day when you need 1,800 or whatever. But for me, the sleep is huge, right? It's the hypervigilance, the constant the constant thinking about something or conditioned myself to the point where it's a distraction. Phones, tablets, all that interface, and just the stimulation, is a dopamine dump, and you end up, I think we're far more exhausted and we're far busier than we've ever been as a society because of these things.
And you also chose a profession that's 24/7.
The hell was I thinking?
Right. I mean, and probably a big part of why you're a top performer and you're very good at what you do, and you do a lot of businesses.
Constant work, distraction. I haven't thought about it like that. My thing, I can tell. I call it when the darkness is setting in. I start to isolate. Video games. I'm aware of the substances, so I steer, away from that. I won't, my one hobby, as you're aware, is golf, right? We play
Which
together.
Which can be obsessive in and of itself, right? Because you're never going to master it. You're never
exactly.
Gonna get to where
it's
you
the pursuit of perfection with the knowledge you will never get there, right?
This is why I don't golf.
What bigger hamster wheel is there? Not playing golf. I love golf, right? But if I'm not interested in playing it, okay, that's kind of a red flag in the back of my mind.
Interesting.
Or if I'm avoiding social engagements,
Right.
I find that if I don't get my ass up and going by 6:30, 7 o'clock in the morning, I'll be in pajama pants until 2.
Yeah.
Right.
It's filling your schedule purposely, distracting yourself. And the sleep thing, but it's like I said, it's a vicious cycle. If you're not getting good sleep, it's almost impossible to maintain.
Yeah.
Right. And if you're running at 65%, energy all the time, but you're in a dynamic, whether it's a industry or a job or you got family, you're set up to fail. And just yesterday, I went and spent more money on a bed than I ever thought possible, with all the, adjustments and all that, because I can't do it anymore. I'm getting older.
Yeah.
I've lived a lot of life in the last 20 years, and I'm tired. I told my wife that. I'm like, look, honey, I'm tired. And I don't know how to not be tired. I don't know. Do I need to take a year off? Do I need
You've probably
to?
been redlining for.
And that's
for
the
so
thing.
long.
If you're redlining for so long, it's a great term, Josh. Thanks for saying that. You're going to flame out eventually. You're going to run out of gas.
Right.
It's going to exhibit itself in a number of different areas. And I find that, the longer I'm in my career, this does get easier, right? Because I'm 5-6 years in.
Right.
I'm almost 200 transactions.
Yeah, you have a
in.
book of business.
It's
kind of like the referral
you-
stuff starts
right.
to happen.
You don't have to. I mean, when there's a transaction going on, obviously there's 197% of my effort going into that. But the first couple of years of the business, it was always 85% of the effort was going to grow it, to grow the business, to gain the clients, to get the the book of business, that kind of thing. Now it doesn't quite take that as much time, to advertise, and I do very little of that anymore. It's predominantly referral, but I have more time, which means I have more time to isolate, more time to procrastinate. It's huge. I am in the top 1% of successful procrastinators on the planet. I'm confident. But that's it's a constant it's a constant battle. Maybe not a battle, but you have to be aware.
Yeah,
you
that's
have to
what
see
I was
the
going to
things
say.
coming.
To me, like what I pick up from what you just shared is that you have a great awareness for who you are, and which probably came from a lot of your hypnotherapy and your talk therapy and all those things that you were open to doing, right? So if I was listening to this or watching this, I would see, wow, like you found an outlet that was healthy. You have enough checks to be able to say, okay, wait a minute, maybe now it's getting into that gray zone of I need to correct, right? Like I need to get the rudder back in the water and get going on the right track, and getting all that treatment and talking to people and being open to that, and the birds and the garden and all that stuff has kept you to where, like, if anything's obsessive, it's your work, right? Which is better than the bottle or better than, you know what I mean? A lot of other things. And even then you're able to say, okay, wow, like, am I, like you said, going dark, right? You have this check where, like, okay, I'm kind of going to this space.
Yeah, it's coming on.
You know what I mean? So I think that's amazing. I think that's a success story that anybody that would be struggling with something like this would say, wow, it took 10 years, 12 years or whatever, but like there's light at the end of the tunnel,
Right.
which is kind of the purpose of this whole conversation, right?
Yeah.
It's like
Yes.
if there's
Yeah.
one person out there that's listening or watching and they go, man, I'm going to look on the internet and check this out, or
Right.
someone who has looked on the internet but hasn't pulled the trigger on going to talk to
Yeah.
somebody, that they're going to go do that, then our effort here is worthwhile, right?
Yeah,
Yeah.
I agree. And you really started hitting on something that we haven't talked about, which is probably I would say it's more the rule than the exception, is people with PTSD are going to experience depression.
Oh,
Right?
without a doubt. It goes together.
Yeah,
PTSD, depression,
yeah.
anxiety.
Yep.
It's a package deal.
100%, and I think that's tough too. And it's so great that you've started to find those red flags for when that darkness is creeping in. But if you think about kind of what PTSD looks like, and this, the word that I've said over and over again is avoidance, and your world becomes smaller and smaller and smaller, and suddenly I can't go, to the grocery store because I can't be in crowds, or I can't be with my kids at the soccer game because or the track meet because they do the guns that fire, or I was in a car accident at this intersection, so I can't go to this part of town anymore. And that's hard when your world is so small that it feels like you're running on 65% every day. You can't sleep, and then everything makes you think about this trauma unless you avoid it. And it starts to get really dark really quickly. And that goes back to what you mentioned, Josh, at the beginning with the suicidality, right? If there's all this going on, you're depressed, you're anxious. We didn't talk about irritability, but that would be another one on my top 5 of PTSD symptoms. You're irritable. People around you are feeling upset by your behaviors, and it kind of you start to ask the question, what is all this for? And so we see that suicidality kind of start creeping in around the edges as you're dealing with this for longer periods of time, which is also really treatable. If you are noticing thoughts of wanting to be dead or even thoughts of wanting to act on suicide, there are treatments out there that can help you get through that and find some hope. It's hard, but they're there too.
Absolutely.
Yeah.
Well said. I wanted to ask a question that'll kind of lead to something else, but what about like group therapy? Is that a big part of what you do, or is that good or bad? Because I know it's a very personal experience.
Yeah.
You know what I mean? So like it's whether it's a rape victim or a veteran or something like that, like kind of I don't know, I guess assumed in that environment is the fact that these people are all going to be open to sharing their stories with other people. Yeah. So there's kind of some weirdness there, but like is group therapy, is finding common bonds or saying, hey, I'm not the only one, and sharing in those things, is that something that you do or you set up?
Yeah, certainly we do some groups, not for trauma focused specifically, but groups can be really helpful for a number of things. And this goes back to kind of the prior question of, are you comfortable in a group? Would you be willing to be vulnerable? And so thinking of trauma-focused groups specifically, oftentimes you'll kind of see one of two things, which is either it's all one gender or the gender you identify with most. So it might be kind of sexual assault victims and car accidents and combat trauma, but all women, or people who identify as women, and then maybe a group for men, or the same trauma and it's sort of mixed genders. So you might have all combat trauma and you'd see anyone who's male, female, or otherwise kind of in that group. And it can be really helpful. So, when I did group therapy in the VA, predominantly men, predominantly older than me when I was in my training, and all people who had served, and even more specific than that, potentially serving in combat zones. And I was none of those things. And so while I came in with this knowledge, it was really helpful to have a group of people. And even when I worked with all women, right, even if there were women who were even closer to my age, they still didn't have that component. And so having other people say, I experienced that too, or I feel exactly the same way, because I have all of this stuff that I know works in treatment, but I haven't walked there. So it adds a really nice component, I think, to things that, your clinician can't possibly have experienced everything. And even if it is, let's say it's a veteran clinician working with a group of veterans, they might not have been deployed or been in combat. So having that camaraderie can be really, really effective. You just have to be sure that you're able to share. So it's sort of like what you were mentioning, Ryan, with it's not going to work if I'm going to keep hiding things, right? And if I don't feel comfortable enough to talk about these things because I'm worried about what others in the group might do or say, then a group probably isn't going to be best for you. But there's lots of benefits. And then the other pieces of the group that are really helpful is you start to form bonds, relationships with these other people when you've been really isolated. You're not alone. That idea, I'm crazy, something's wrong with me, starts to get sort of washed away because, 6 other people in this room feel exactly the same way. And then you feel less alone. And so it can really help in that regard too.
Yeah, it kind of puts context to a lot of the theory too, right? So if you're like, hey, you need to come up with a hobby, but then he shares that he does the gardening and the birds, then I'm like, wow, that's cool.
Exactly.
That's what it looks like, right? And it's also like if I'm, going through and I'm struggling with being open and I see a guy who's, like Ryan, and he says that, it's like, well, I mean, if Ryan can garden.
Right.
Like
exactly.
You shouldn't worry about that stuff, but that's
what we do as
part
humans.
Of what people do, right? People care about what other people think and how they look and all those things.
Yeah, I totally agree. And a couple of things that have that I wanted to add was I think it's incredibly important that if you're the family member, specifically a spouse and kids of age, to understand kind of maybe there's something daddy or mommy struggle with, specifically in my house. I have 3 little girls, 16, about to be 13 and 6, right? And based on my clinical research, wink, wink, women, or the fairer gender, their level of enjoyment is measured purely on the amount of noise that is being, thrown out. The screaming, the yelling, the laughing, the whatever. But the and one of the triggers for me is, very loud, noise that I'm not prepared for. The kids will do that. Like a broomstick falling on tile floor. Like you get that snap real loud.
Right,
like,
and makes you almost irritated.
Boom! I'm up. Like I'm on edge. So and I think my wife struggles to understand it completely, and I haven't done a great job of explaining it to her. Right. But I think maybe a conversation, or at least a group understanding of when there is those loud noise, and it's not, for me, it's not as bad as it used to be. Some guys and gals struggle with the fireworks at the 4th of July, or
Right.
but that's a scheduled event. It's going to happen every
coming,
year.
right.
It takes me a day or two to mentally prepare for that, and I'm fine. But I think having an understanding at home of what the service member or the individual, the victim, whatever you want to refer them to them as, is what they're really dealing with. How
Right.
and that it's not voluntary, right? It's not like we choose to do this. It's it's anything but.
Right.
So I wanted to make that point for anybody listening, that is a spouse or is somebody who. The other thing is that I've found a lot of value in is for other folks, other guys, specifically in my circle. We've had a round table, we call it, 2 of them, and it's at my house. Guys that I've served with going back to 2000, 2001. Some of them are still active, some of them are not. But based on my willingness to share openly within that circle has been positive from the perspective of they'll come to me, but they'll skirt, right? They start asking maybe these kind of leading questions. I know what they're up to now. But just engage in the conversation and say, hey, look, there are so many more people that are still kind of hiding this issue, right? And suffering unnecessarily. And, the round tables we've had, it's just open. It's non-judgmental. There's not anybody that's a professional there. It's just, hey, this is what works for me. I've shared the gardening thing. They've seen the birds. And just talk about, hey, this is what I'm experiencing. Share as much as you want. Share as much as very, very, very informal, right?
Right.
And there's usually a 20-year-old bottle of scotch involved to get things loosened up, right? But it's good. And there's, I retired at 16 years under the Temporary Early Retirement Authority. Most of my generation, if you will, stayed to 20. So I mentioned earlier I've been out for 5 years. These guys are retiring now or sticking around. But I would say, to anybody out there that's done the work or is going through it currently and had success, don't be afraid to share that.
Yeah, share that love with some of your some of your brothers or
it's a
sisters
different
that-
world
yeah.
now. It's a different society. It's, why, as a selfless group of people that has been conditioned to be so selfless, why not throw that out there? There, you might get some pushback. You've still got, some of the older generations that view it as, weakness or whatever, assign a stigma to it. The reality is, if you don't make a change, right? If you don't help somebody else make a change, no, it's not going to get any better. And what good is your experience if you can't share it with somebody else and maybe help them?
Right.
You know what I mean?
I really like what you said about the about family members and people around you too.
Yeah.
And being honest and letting them know, hey, these might be triggers for me. Because whether it's a veteran that the broom hitting the tile, or it's someone who maybe was a rape victim and the person grabbed them or touched them in a certain way or called them something, or it was around this location, and for them to say, hey, listen, just don't touch me here.
Right.
Like that, just
Right.
you know what I mean? Like giving people, because sometimes people don't know, right?
Right.
So if you
Yeah.
help the people around you to help you with your own happiness and your own therapy and success, I think that's huge.
Yeah.
Because people just don't know. I mean, I'm
Right.
in that
Yeah,
boat.
and it's
right?
impossible to articulate unless if you haven't experienced it. I've tried I don't know how many times,
Yeah.
But
It's kind of just like, this is how it is, and
it's just the way it's going to be, and we do the best of it.
Yeah, because that's what I was going to ask when I said it was going to lead to the question about group therapy. Was I imagine you get a ton of enjoyment and reward intrinsically for the work that you do with, and you jumped right into it with, other servicemen and women. Like, I know you do a ton of charity on base, and you have golf tournaments, and you could do that anywhere with any other group, right? But like, you're drawn to that, and I imagine a big part of that is giving back.
It is. It's I'm far more successful financially than I ever thought I would be, and that's where I feel like my skill set would have the most positive impact. I could involve myself in other charity opportunities, but I don't feel like I would be quite as effective in, I don't know, sexual assault victims. I've never experienced that. I don't know what that's like. I would feel fake trying to, do that. Obviously, I've cut checks to other, opportunities and that. But as far as my physical involvement, my voice, however it is I can help, because having been through that and knowing just the pure volume of service members out there, past and present, that are struggling with one thing or another, I can help with that, and I can make recommendations, or I can share experiences, or be like, and openly, I don't care what anybody thinks of me. I really don't. But if I can help somebody, through an experience, through a process, hey, where do you live? What's close to you? What are you interested in? What is something that you would never think of to do? And that was gardening. You know what I mean? Like, that was like so random and so unexpected. All I really wanted to do was make homemade salsa. You know what I mean? And the positive, emotional, spiritual, and mental payoff was unexpected.
I see it though. I've landscaping is super therapeutic for me. I'll just go out in the backyard.
Sweet, I got a backyard.
Yeah, we can plan.
My wife will come out and she'll be like, "Are you just?" And I'll just stare.
Yeah.
Because I'm almost thinking, like, what would go here, what would go there. I want a tall one here, I want a short one here. I want to make sure enough colors there, but I want to go over the top red. I want to mix it. Like, I get kind of weird and neurotic about it, but I could stand there and stare at it with a cup of coffee in the morning on the weekend for like a half hour, 45 minutes. And kind of like what you said, it's just that process of being present and not being in work or anything else.
And it feels good.
Yeah. It feels amazing. Well, I really appreciate you guys being here. I think anybody listening to this or watching this is going to get a ton out of it. And, if someone out there is struggling and wondering, hey, why am I not getting a ton of sleep? And they maybe had a traumatic experience, whether they're a veteran or a victim of something else. If one person reaches out or kind of takes that next step towards getting better, then we win by being here. So,
Well, thanks for having us, Josh.
Yeah,
I really
thank you
appreciate it.
so much. I really enjoyed the conversation.
Yeah, man.
Thanks.
All right, guys. Thanks.